Hi everyone, welcome to my channel. I am Athena Newell. I am a functional medicine nurse practitioner. I have been working in functional medicine for about 6.5 years, and there's a sentence that I hear almost every single week. It's something to the effect of, my labs are normal, but I don't feel normal. Or I went to my primary care provider, I told them how I was feeling, and they brushed me off. Or I felt rushed, or I was given a prescription, I didn't really understand why, or if there was anything else that I could do that was more lifestyle based. So they're looking for a little bit more guidance than being brushed off or given a pill. These people are feeling exhausted, they're inflamed, they're feeling anxious, they are struggling with their weight, brain fog, hormonal issues, and they're just being told that everything looks fine. And the problem is that when we draw labs for some of these conditions, we're looking for the danger. And maybe there isn't something that's life-threatening, but it is affecting their quality of life. So we need to start asking the question of, why is this happening in the first place, so we can get to the root cause of why, so we can help these patients feel better. The gap is being told that you're fine when you know you aren't feeling fine. And this is exactly where functional medicine really shines, because we want to understand why. So let's talk about functional medicine, what it is, how it works, and who it really works well for. Functional medicine is a root cause approach to medicine. We really want to understand what's going on underneath. Why is this happening in the first place? We're also looking at this from a systems biology perspective, which means that you are one person with many systems in your body. So you have an endocrine system where your insulin works and your reproductive hormones work, hormones that affect your mood. We have a GI system that digests our food and absorbs our nutrients. We have a heart and we have lungs. And a lot of times these systems all communicate within each other and affect one another. So if we can work on the root cause that affects multiple systems, we can sometimes see improvement in symptoms across systems. And we're very patient focused. When a patient tells us that they have a goal or they have a symptom or they have a priority, we are going to focus on that patient's experience and what is important to them. So one key difference is that we are pattern based. We're seeing patterns over the course of time with our patients and not just diagnostic based. And we don't necessarily need to take an either or mindset between conventional and functional medicine. But I will say that where conventional medicine really shines is acute care, emergency, trauma, oncology, really life-threatening and dangerous conditions, but patients aren't necessarily struggling with those things. Where I think conventional medicine struggles is multisystemic issues where there's systems outside of a particular specialty, so you'll get pointed to another specialist to deal with those symptoms, or slow burn symptoms that are affecting your quality of life, like chronic inflammation or chronic pain or chronic fatigue. I think functional medicine does a really great job of filling in the gaps with these patients and crossing systems to help support the whole person. So core principles with functional medicine is we're whole body system focused. We are personalized and individualized care. We are not a one size fits all. There are protocols that sometimes we will follow, but we are going to build a protocol around each individual person. We are also looking for patterns that are happening over time and not just in isolated instances or isolated sets of labs. Let's talk about what functional medicine looks like in practice. A lot of our patients come to us after doing a free 15-minute consult where we've started to talk to them a little bit about their medical journey before they even make their first appointment. A lot of functional medicine practices will start with an initial visit, either 60 to 90 minutes long. At Stat Wellness, we do 60-minute appointments. And the most important thing that we do during that time is put together their medical timeline. From the time that their mom was even pregnant with them or trying to conceive them until now, what has their health journey really looked like? This is where we get to see patterns in time and what's been going on that kind of all adds up to this current moment and how they're feeling. We look at their stress, their sleep, how they move, how they eat, what their environment is. So during that appointment, we put all of those pieces together. We also discuss if we're going to have strategic labs drawn. So that might be blood work, basic blood work, or comprehensive blood work. I might use their insurance for those things. We might also do functional testing, which is stool testing, hormone testing, nutritional testing. So we have a wide variety of testing that we can do strategically for that particular patient. Once we get these tests back, we'll review them and put a plan into place for that patient. Who is functional medicine for? This is great for somebody who is just feeling off and not really sure why. Maybe they've been to the doctor, maybe they haven't, and they're not really getting answers. Somebody who's having chronic symptoms, but their labs look normal and they otherwise haven't gotten any answers as to why they're feeling the way that they do. Another type of person might do really well in functional medicine that's preventatively minded. They want to look at well care versus sick care. They want to be the best version of themselves and optimize their health for longevity. This is typically not a great option for patients who want a quick fix or want to just be told what to do and have passive care. Now, I will put a caveat in that and say that there are some patients that feel overwhelmed by their health journey. They don't know where to start. There's a lot of noise out there, and a lot of our patients are coming to us because they want guidance in the right direction. I can't do 50 things. Help me pick 5 things. They just want a little bit more guidance. I wouldn't call that passive. I would say that we want to partner with our patients in that case. Another big thing about functional medicine is lifestyle is a non-negotiable. So we really believe that lifestyle is the foundation for our health and always should be our number one priority in all of our patients. That's focusing on quality nutrition. That's quantity and quality. Sleep quality is a big important thing that we need. Stress management. We need to move our bodies. We need to manage the relationships and the support that we have around us because that will impact our health as well. And then one thing that I like to add is also our environment. What's our air quality like? Water quality, microplastics. I think we're starting to realize that those things are having a bigger impact on our health than we maybe realize. And I think we need to shine light on those for some of our patients too. So how do you get started? I think it's important to have a conversation about your health before you start testing random stuff. Sit down with somebody who can look at your medical timeline and patterns and conditions and symptoms over time to decide what testing would be good for them. A free 15-minute consult with a provider is a great place to start to bring clarity as to what the journey might look like. And then jumping into a new patient appointment where you can dive in deep with a functional provider. So if you are feeling intuitively that something is off and you haven't really gotten answers, we don't want to normalize feeling dysregulated or having dysfunction or feeling poorly if there are answers that can be found. So we really want to help our patients feel that. So let's reframe this to start thinking about things curiously and informed instead of feeling like, oh, dismissive and this is just not a problem. So thank you for coming and listening. If you have any questions, you can find me at the handles I'll list below. And stay tuned for more videos about functional medicine and how to optimize your health.